People with dementia may have quick changes in their moods without explanation, which can be challenging for carers. As a carer, it's important to understand why this happens.
Becoming a carer for a person with dementia can trigger a range of emotions. We've had carers tell us about feelings including anxiety and fear and worry, feeling anger and confusion, but also some really positive emotions as well. So the journey of being a carer can lead a whole roller coaster of feelings, and that's okay. It's okay to feel differently to another carer. We also know that the emotions that you might experience as a carer can impact on the way you interact with the person with dementia, and therefore the way they might respond to you and behave. So what we want to do in the Virtual Carer Centre is present a range of strategies that you might be able to use to help you to understand what you're feeling and why, and perhaps give you some ideas about how to manage some of the feelings that might potentially present challenges and affect the way you might care for the person with dementia. When you're caring for someone with dementia, although you might feel that the way you're feeling and your emotions are concealed, often they might be revealed in your body language, in the way you speak to and interact with the person with dementia. So they might pick up on how you're feeling even if they don't understand what you're feeling or why, and that can impact on their behaviour and the way they approach the situation, which can sometimes lead to behaviours that might be more difficult to manage, or situations that are more tricky for you as a carer. So we want to help you to think a little bit more about how those emotions might affect the way your body language presents, the way you speak, the way you approach some of the caring tasks you might have. It might be, for example, that you have a slightly shorter fuse. It might be that you're potentially rushing the person with dementia. It might be that facially your face gives away the stress you're feeling inside, and that can impact on how the person with dementia might feel and respond to the situation. Managing your emotions as a carer for someone with dementia is hugely important, because we know that your emotional well-being is going to be one of the factors that determines how long you can fulfil that caring role, and how the person you're caring for is also going to be feeling and able to stay with you in that caring relationship. So managing your emotions is something we really want to focus on a lot in the Virtual Carer Centre, because we feel that if carers have the right understanding of what they're feeling and how they can work with those emotions, and they could be positive and negative emotions, that can really keep that person feeling able to care for longer, help them feel that they can manage and work with those emotions, and also can share how they're feeling with those people around them.
Many carers tell us that their friends and family don't always understand their needs. On this site, you can hear from other carers about how they manage emotions.